The Health and Social Care Act was passed last year in 2012 and it was brought in by the current coalition government, having promised no new top-down reorganisation of the NHS. So it was a surprise to all of us that there was going to be this major piece of legislation which was bigger than the original act that founded the NHS and many people said was the biggest change to the NHS since it was founded. So the government claimed that this act was going to empower GPs like me to improve local services, empower patients and reduce bureaucracy in the NHS. They didn't say what the real purpose of the act was, and the reason for that was because no one would have voted for them if they did say that's what they were going to do. And the real purpose was to change the National Health Service from being a public service, i.e. provided by the government, to a private service provided by private companies. The fact that it would still initially be free at the point of use doesn't mean that then everything was going to stay the same, because if it's going to be provided by lots of different private companies all competing with each other, that's a completely different kind of health service from the one that we currently have. And GPs like me were very concerned about this because we felt that it was going to lead to increased bureaucracy, and lo and behold, we're right about that. They replaced 3 layers of bureaucracy with 7. I mean, nobody can quite keep track of all the new organisations that have been set up. It certainly has not empowered GPs, and it's certainly not going to empower patients who are going to struggle to make sense of this new complex health service they'll have. So that's in a nutshell what we think is wrong.
One of the things that we're hearing a lot about right now, which seems to relate to this, is the Section 75 privatisation regulations. Can you tell us a bit about what difference those regulations will make to the NHS?
Yes, I mean the Health and Social Care Act itself was in many ways quite vague about exactly how CCGs were meant to commission services, the detail of what was expected of them. And that level of detail is something that normally comes out in what are called secondary legislation or regulations. Those sorts of secondary legislation and regulations tend to go through on the nod through Parliament without even a debate. That's the standard practice. But luckily campaigners have picked up that these regulations that are going through Parliament just now are really important and have actually forced a debate on this through campaigning. I think that shows the power of campaigning. But also the importance of being alert to what's really going on, because the new regulations are actually going to force CCGs to put all contracts, when they come up for renewal, all of them out to tender, competitive tender. That includes hospital contracts. And the problem with that is that that will lead to huge amount of work for CCGs, because the cost of actually running even one competitive tendering process is thousands of pounds. If you're having to do that for many services, you're talking about tens, hundreds of thousands. In fact, the whole cost across the country could be in billions of what we call transaction costs. It will also absorb all the time of the CCG, the clinical commission groups, and part of their job is supposed to be looking at improving healthcare in the community and lots of other things. They will be too busy just running tenders. But also, if the private sector competes and wins a lot of these tenders, which they may well do because they can undercut on price, then they tend to take the more straightforward kinds of cases that you can, the costs are predictable, so they can predict what kind of profit they can make. If they take those cases away from the NHS hospitals, the NHS hospitals lose a very important funding stream that they depend on, because what happens in an NHS hospital is that the more straightforward work subsidises the more complex urgent care.
Because the government pays money for the money follows the patient.
Yes, so every item, and that's a relatively new thing over the last few years, every single thing that happens in a hospital, money attached to it. So if somebody comes into hospital and gets a hernia operation, the hospital gets some money. If somebody comes in and gets treated in A&E, the hospital gets some money. Or if they need an emergency operation, the hospital gets some money. The interesting thing is that the payment for more routine stuff is better. It's a better rate of pay than the payment for urgent and emergency stuff. So there's more money to be made from providing lots of hernia operations and cataracts and hip replacements and all those things than from providing emergency care. So routine care subsidises emergency care. They cross-subsidy, and the whole thing together becomes an economically viable package that enables a hospital to run. If it loses its straightforward cases that bring in that funding stream, it's left with the really expensive stuff, which can rapidly become unaffordable. We're already seeing hospitals teetering on the brink of bankruptcy because for various reasons their funding has been cut. It doesn't take much more to tip them over into being bankrupt. That then leads to hospitals either closing or merging with other hospitals to try and stay afloat. And that's part of, I think, what we'll see that in the future, fewer and fewer hospitals, bigger and bigger ones coming together as bigger hospitals to try to survive financially. Especially if the private sector is allowed to remove the funding stream that comes from providing routine care. So that's really the fundamental risk. It doesn't bother me if the private sector's there and trying to provide some services that some people might want. I don't really, it's because of the impact and the dynamics and how it could change the care and destabilise the provision of care in the NHS as a whole that worries me. As well as that, of course, the sheer waste of money of running a competitive market economy when we're already cutting services because we haven't got enough money. It's already estimated that the cost of running the market up till now is about £10 billion a year. That's going to be much more if these regulations are passed. It could be 20 billion a year, 20% of our budget. Could even be 30% of our budget, 30 billion a year, because that's what they spend in the United States, 30 cents in every dollar on administration costs. And we could be moving in that direction. So for those who say we can't afford the NHS as it currently exists, I say we can't afford the market.
And you mentioned about the regulations and the promises that were made last year. I think there were a lot of, I remember following it, and there were a lot of promises made to the leaders of the medical professions that, you know, this act there was nothing in the act that was about promoting or permitting privatisation. Do you think perhaps these regulations, you know, people look at these now and think, oh, hang on a minute?
Yes, well, I think some people were really duped by the government and they wanted to believe the best. So when Andrew Lansley, who was the Secretary of State for Health before Jeremy Hunt, sent a circular around to all GPs, and you know, I saw it too, saying there's nothing in this act which means that you will be forced to put things out to tender or to use competition. It's going to be totally, if you want to, you'll be free to decide when to use it. Many people believed that, and why shouldn't you? This is the Secretary of State for Health telling you something. And not just that, many of his ministers did, and so we had it repeatedly. Also, I think Lord Howe, who was the leader of the government in the House of Lords, made a very similar statement. So people were sort of lulled into a false sense of security. Some people were, and these regulations show exactly what is being planned. So that's why we think those regulations are very, very dangerous. And also we don't see why they're necessary. Why is the government insisting on this regulation? It's because they really want there to be a competitive market, and they really want to open up the NHS to the private sector. That's what they've promised the private sector. There's going to be a big bonanza, there's going to be rich pickings, they've said that, and lots of money to be made, and that's what they're trying to make good on their promise. They're more concerned with making good on their promises to the private sector than their promises to the electorate that elected them. In fact, they have completely reneged on their promises to the electorate, but they're certainly not going to, they look as if they want to keep their promises to the private sector, which is that they can make a huge amount of money out of the NHS.
And do you think that it's interesting now, the politics of it in Parliament? I mean, do you think they made it clear to members of Parliament, to people, to maybe even to members of the coalition government? You know, was this made clear?
I think people hide behind things, saying, "Oh, we didn't really understand the wording." They must understand it perfectly well. If a lay person like me, I'm not a parliamentarian, I'm not a lawyer, can read through it in 2 seconds. They, unfortunately, members of Parliament and the House of Lords, many of them have got big financial stakes in the private healthcare industry. That should have actually meant that they weren't allowed to vote on these on the Health and Social Care Act, but it's for some reason they're still allowed to vote, even though that's a huge conflict of interest. I think people know perfectly well what's going on, and I think they care more about honouring their, as I said earlier, they care more about what they see as their duty to the business class than their duty to the electorate that voted them in. So I think it's a fundamental question of democracy. It's not just about the NHS, it's about how our representatives operate.